Hypertension is a two-part series. This video is part 1 in this series. Hypertension. Hypertension is increase in blood pressure, BP. The increase in blood pressure pertains to increased pressure in the arteries, that is, blood vessels carrying blood from the heart to all areas of the body. This is referred to as systemic arterial hypertension. This video pertains to this type of hypertension. Systemic arterial hypertension hereafter will be referred to as elevated blood pressure or simply as hypertension. There are two other hypertensions, namely pulmonary and portal hypertension. These are discussed briefly here. They will be dealt with as separate videos. Pulmonary hypertension. Increased pressure in the arteries arising from the heart, that is pulmonary artery and its branches, distributed all over the lungs for oxygenating blood. This is known as pulmonary hypertension. Portal hypertension. Portal hypertension is increased pressure in the veins, draining from the intestines into the liver, called portal venous system. Hypertension definition. Elevated systemic, that is pertaining to areas all over the body, systemic. Blood pressure, elevated systemic blood pressure is defined as resting systolic blood pressure, SBP, of 140 millimeters or higher, or diastolic blood pressure, DBP, of 90 millimeters or higher. The upper value represents the systolic blood pressure, SBP. This is the pressure perceived by the arteries when the heart contracts and pumps out blood against the peripheral resistance of blood vessels. This force is measured as millimeters of mercury, technically denoted as mmHg, H capital. The lower value represents the diastolic blood pressure, DBP. This is the pressure in the arteries when the heart rests between successive waves of contraction. Note: blood pressure is commonly noted as 140/90. The blood pressure value is traditionally written as a fraction as above, but has no meaning as a fraction in the conventional sense as represented in mathematics. Dear listeners, by the way, this educational video is made possible by Prescribon, the makers of e-prescription software for digital prescriptions, available freely for doctors on the website www.prescribon.com. Doctors who are interested in this e-prescription can freely avail of its vast collection of more than 100,000 e-prescriptions. Now back to hypertension. The global burden of hypertension. Hypertension afflicts a substantial proportion of the adult population, that is 1.3 billion people in 2019 worldwide, and a growing number of children. By 2025, it is expected to increase to 29% of the world's population, affecting 1.6 billion people. Of these patients, 2/3 live in low and middle income countries. Hypertension remains the single most important preventable cause of premature death worldwide over the next 2 decades. About 7.1 million deaths per year may be attributable to hypertension. In India, hypertension accounts for 57% of all strokes related deaths and 24% of coronary artery disease related deaths. About 45% of adults with hypertension are unaware of their hypertension. Only less than half of them are diagnosed and treated. Only 1 in 5 of hypertensive patients have their hypertension under control. Hypertension is one of the major risk factors for cardiovascular disease, including heart disease, peripheral vascular disease, stroke, as well as renal disease. Obesity and aging of the population are increasing all over the world. Hence, the number of hypertension persons also are likely to increase. For basics of blood flow, see Prescribon medical education video on circulation. Risk factors for hypertension. Age. The prevalence of hypertension increases sharply with advancing age. At age 30, only 7% have hypertension. By 75 years, about 75% are having hypertension. 9 out of 10 older people will develop hypertension before they die. Systolic blood pressure gradually rises steadily with advancing age. Diastolic blood pressure gradually rises up to 50 years, after which it is steady for several years, and then there is a steady decline to the end of usual lifespan. Only in societies where salt intake is low, physical activity levels are very high, and obesity is rare, are age-related increases in systolic blood pressure avoided. Arterial compliance and stiffness are the main reasons for the differences in blood pressure with age. Note, arterial compliance is the ability of the arterial wall to distend and increase in volume with increasing pressure. Arterial stiffness is opposite of arterial compliance. Stiffness in arterial walls is due to reduced elastin fibers, collagen fibers ratio, elastin cross-linking, thereby elastin fibers becoming less elastic. Reactive oxygen species, that is addition of an electron to oxygen molecule O2, this induces inflammation, calcification of arterial walls, smooth muscle cells in arterial walls becoming stiffer, and endothelial dysfunction. All these factors contribute to the development of systolic hypertension and decrease in diastolic blood pressure with age. See structure of arterial walls in Prescribon medical education series, atherosclerosis part 1 and 2. Elastin fibers in arterial walls are compliance aiding, that is giving elasticity, that is extensibility and resilience to the arterial walls. Collagen fibers are stiffness aiding, that is relatively inextensible, serves as a stiff reinforcing element providing structural support. Collagen is the main load carrying element of arterial walls. Body weight. Increasing weight is one of the major determinants of increasing blood pressure. This is true in younger children as well. Overweight and obesity accounts for 70% of risk for increase in blood pressure in hypertensive patients. Incidence of hypertension as related to body weight. BMI below 25 means 15% risk for developing hypertension. BMI between 25 and 29.9, 28%. BMI 30 or higher, 42% risk. Note: Body mass index (BMI) is a measure of body fat based on a person's weight in kilograms divided by the person's height in meters, which is squared. Below 18.5 means underweight, between 18.5 to 24.9 healthy range, 25 to 29.9 overweight, and above 30 means obese. Diabetes. Diabetes is associated with a risk for hypertension 3 to 4 fold. Smoking risk for hypertension is twofold as compared to non-smokers. Sex. Sex influences the prevalence of hypertension in an age-dependent fashion. Until about the 6th decade of life, men have a higher incidence, after which women predominate increasingly. Women are more affected by hypertension in part because of their longer life expectancy. Ethnicity. African Americans, that is, Africans settled in America, are disproportionately affected. They have one of the highest rates of hypertension in the world. Educational level. Lower educational level is strongly associated with hypertension. This is mainly due to the diet difference, that is high calorie, high fat diet and BMI, and not due to educational level as such. Minerals. Sodium, that is common salt. High dietary sodium is related to higher rates of hypertension. Higher potassium, calcium and magnesium appear to be associated with lower rates of hypertension. Diet. Vegetarians have lower incidence of hypertension. Alcohol. Hypertension is twice as common in alcohol users as compared to those who do not indulge in alcohol. Effect of hypertension on other diseases. Hypertension is a major risk factor for atherosclerotic cardiovascular disease and other diseases of the cardiovascular system. Blood pressure levels are directly proportional to the risk of developing cardiovascular disease. Hypertension increases risk for death, myocardial infarction, that is MI, that is death of a portion of myocardium, the heart muscle, heart failure, that is less than required pumping force due to weakened myocardium, left ventricular hypertrophy, LVH, increased muscle volume of the left lower chamber of the heart, called left ventricle, due to various causes. Atrial fibrillation, ineffectual rapid contraction of the upper chambers of the heart. Stroke, decreased or interrupted blood supply to a part of the brain, preventing brain tissue from getting oxygen and nutrients. Brain cells begin to die in minutes, resulting in sudden numbness or weakness in the face, arm or leg, especially on one side of the body, or transient ischemic attack, that is a mini stroke, peripheral vascular disease and renal failure. The risks are relatively more for heart failure and stroke. Isolated systolic hypertension. In some people, only the systolic blood pressure value is high. This is called isolated systolic hypertension, that is ISH. It is also a risk factor for adverse cardiovascular disease outcome in older individuals. Primary, that is essential hypertension. Primary hypertension accounts for more than 90% of hypertension patients. Systolic blood pressure, SBP, as the main risk factor. Because most hypertension, more than 75%, occur over the age of 50 years, SBP rather than DBP, that is diastolic blood pressure, is by far the most important contributor to the huge global cardiovascular risk burden attributable to hypertension. Dear listeners, this is the end of part 1 of hypertension. Part 2 of hypertension is a separate video. See Prescribon Medical Education Series Hypertension Part 2.